Hi, my name is Soyoung and I'm going to talk about the patient-centered care. Patient-centered care means active involvement of patients and their families in the care plan and in decision-making about individual options for treatment. Patient-centered care focuses on the patient and the individual's desired healthcare needs. The goal of patient-centered care is to help patients to involve in their care. Patient-centered care is patient-focused. I have a patient recently. He came with a viral respiratory infection with a high fever. And also he has vomiting and diarrhea. And also he has acute renal failure issues. And also he has liver enzymes all elevated because he has a history of hepatitis C. And his electrolytes was imbalanced from all his problems. And he has weakness and also blood sugar level was over 800 when this patient came. He has medical history of diabetes type 2, hepatitis C, and kidney failure, and high blood pressure. Patient's individual needs, I'm going to talk about. He is a 64 years old male patient, and he lives with a boyfriend. And he is one of our physicians who work as a pediatric specialist. So lots of nurses kind of afraid of giving him care because he's a physician working in our hospital. And his religion is Amish. He had a decreased appetite. He has some food he can have and he cannot have actually. And he was able to access his medical record because he was one of our physician in our healthcare team. And he was very intelligent and quiet person. Patient knows about the patient rights well, and also he knows healthcare system very well too. This patient came to our hospital. Our hospital has acute setting hospital. Usually patient came for 3 days to get better and discharged. And he came to our floor. Our floor is medical surgical unit. And we use electronic medical record and charting. And our hospital is teaching-based hospital, work with the Michigan State University. And also our hospital is magnet hospital and also research hospital. This patient has a primary physician was family medicine doctor with lots of resident group. And he also has 4 or 5 consult physicians. One of them was pulmonary physicians to give him treatment for the respiratory issues. And also gastrology physician to help his liver problems and vomiting and diarrhea issue. And nephrologist to help his acute kidney failure to get better. And infection disease doctor involved too because he has a non-etiology high fever for 5 days. And he ended up with the intervention radiology group to involve because while he's here, his side is getting worse, and also he has fluid overload in his lungs, so he ended up had a tap from by intervention radiology group. And nurses, managers, and patient technicians to give him treatment, to work with him. And physical therapists and occupational therapists work with him too, so they can give him strength back. Nutritionalists involved too, and case manager work with him for discharge plans. We usually want to get the outcome for this patient. Usually respiratory failure. We try to give them the treatment for 7 days, and then usually patient able to go home in 7 days to get better. And also we try to give them all resolved medical issues, and we try to provide the individual health needs before they go home. And also our goal is get them strength back before they discharged. And also we try to give them the coordination care and coordination rounding. We do bedside assessment for the patient all the time and bedside care plan with the patient and family meeting if they need. And patient satisfaction is our final goal. Actually, this patient couldn't get his good outcomes. I took care of him about 2-3 days, but I heard he ended up stay more than a month. He stayed more than 30 days in our hospital. And also, while he was here in our hospital, he had additional medical complications like ascites, and he ended up with dialysis twice a week, and also he had to go to dialysis after discharge for a couple of weeks. And also he has weight loss and weakness, so he ended up to go to subacute rehab for a couple of weeks. And he complained about the poor physicians' care coordinations and missing bedside assessment from the doctors. And also he complained about the miscommunications between all doctors group, including consult doctors. Also missing patient educations because doctor assumed this patient is a physician, so they didn't give him enough education about the procedure or test or any new medications about the side effects. He ended up was very frustrated, and he was upset, and he was worried about his conditions. Actually, because he got vacation off from the work because he used all his vacation time in the hospital. As a nurse, I try to give him the patient-centered care. I try to provide bedside shift report all the time, and also physical assessment of a patient at bedside. And also in the morning, I notify doctor about the blood work and test results, and also I gave his information to the patient about the test results and all blood work. And also I explain new orders and new medications and side effects, even though he's a physician. And also request nutritionist to come to help him to get a better appetite. And also physical therapist and occupational therapist to come so he can get strength back. Also, I did try to do charting in his room for his case. These days, we nurse don't have enough time for charting, so we usually do it in the nurse station, so we don't get interrupted by patient or families. But for this patient, I did charting in the room, so I can listen and I can ask what he needs. I try to help to prepare if he wants to eat his homemade food. I help him to heating and preparing the food. and request coordination rounding and coordination care to the managers. So he was able to get the care coordination rounding. And also I encourage the patient and help him to decrease his anxiety. And I set it up time for the patient so I can listen to the patient's opinions and what he needs. I learned a lot from this patient's case about the patient-centered care and patient-focused care. One day, the patient said, "I like all the way to take care of the patient. I know exactly what he needs or what he means because the patient was ignored from his care plan. Our healthcare team didn't focus on the patient and did not provide opportunity for his care plan. There were many miscommunications because doctors ordered online and checked other doctors' notes. The problem was that all the doctors didn't come to check on the patient, and among these doctors, they did not communicate with each other. The patient, as a patient himself, complained of the new computer healthcare system and charting system. Resulting from this, the patient had to stay longer than what was expected. I remember I was busy with this patient to notify all the doctors what this patient needed and ask the doctors to please come and explain to the patient about their new orders, new medications, and care plan, so the patient can involve in his care plan and can make decision about what he wants or what he doesn't want. He knows patient has right to refuse or right to involve in his care plan, but he didn't get it almost time while he is in the hospital. I learned that nurses are caregivers at the bedside who assess the patient and advocate the patient for their needs. If our healthcare team provided well-coordinated care and listened patients' needs, patient was able to stay shorter and had a better experience as a patient. When I said to my patient, sometimes I say, "You are special," to make them happy. And patients are happy because they know and they are thinking that I am, as a nurse, I am ready to listen to them and also help what they need. And I will focus on them to give them the patient-centered care. Thank you.